Hi, so this is the MS2 Lab Practical Final, and we can begin now. So, hello, my name is Michael Taylor. I'm a student physical therapist. How are you doing today?
Okay, I have a little bit of hip pain.
Okay, yeah, I see that you come in with some hip pain today. Can you tell me a little bit more about how it started?
I noticed I'm a laborer. I work and I stand on my feet a lot, and I have right hip pain. It gets worse as the day goes on while I'm standing. I'm usually asleep on my right side, but that has caused pain, so I'm unable to sleep on that side. And sometimes if I put a pillow between my legs, it does help with that.
Okay. So yeah, I was gonna ask. Putting a pillow between seems to make it better. And then, do you have to sleep on your left side now because the pain's so bad?
Yes.
Now, can you describe the pain for me? Is it like a sharp pain or a dull ache or just kind of constant, or how would you describe it?
A little bit constant, more dull.
Constant pain, dull ache.
Yes.
All right. How would you rate your pain right now, with a 0 being no pain whatsoever and a 10 being the worst pain you've ever felt right now?
About a 4.
4 out of 10 right now.
Yeah.
And then, at its worst, what would you rate it? At like the end of the day?
8.
An 8 out of 10. Gotcha. And with that, are you doing anything to kind of treat the pain? Are you using any ice or heat or?
I'm using a little bit of ice. It does a little bit. It doesn't take the pain away.
Mm-hmm. And then, have you had anything like this happen before, or is this like a new occurrence?
New occurrence.
And can you kind of point to me where the pain is? Kind of like the lateral, your lateral hip.
Right. Yeah. Right.
Yeah, right.
Right.
Okay.
Where my hip bends.
Yeah. So pain worse at night, and then.
And yeah, kind of through it. It's better in the morning, but by the time I'm standing on it,
Now, when you're sitting in a chair and then you get up, do you have any pain with that?
yes.
Okay. And then, have you had any imaging done, or does your primary care physician know about this incident?
I haven't had any imaging yet. No.
And I see here, though, that you have a right ankle. You had right ankle surgery about 10 years ago. Is that doing well?
Yes.
Okay. You don't notice any like difficulty using it at all, or any like loss of range of motion, so it's good.
No.
And then I also saw that you had some lumbar decompression about 15 years ago. Did that kind of resolve those symptoms that you were having?
Yes.
Are you currently taking any medication? I do see, though, that you have some hypertension and some high cholesterol. Are you taking anything for those?
No. I'm taking no medicines.
And then, have you had any fever lately, or any fatigue, or anything like that? You just kind of feel crappy, or just mainly just pain?
Pain in my hip.
And then, so you said you're a laborer. Do you work on like in a factory, or?
Yes.
And then, can you describe your house a little bit? Do you live in like a 2-story house or an apartment, or
I live in a 2-story house, so I do have stairs that cause a little bit of pain when going up and down those.
pain with stairs?
Yes.
Gotcha. been to PT before for this at all, or is this the first time that you?
This is first time.
Do you have any hobbies that you like to do?
No hobbies.
No hobbies? And then, what are your goals for therapy? So, like, have you not been able to, like, work because of this pain, or you just kind of been able to tough it out?
Kind of
Toughen it out?
I mean, yeah.
So would you, what's your goal then of therapy?
A little bit of pain, pain relief, be able to sleep at night without, roll on it, it causes you pain, so.
Mm-hmm. Get back to walking again.
Yeah.
Sounds good. Well, I think that takes care of everything there that I've covered. So let's begin by have you up and standing.
Facing you or away?
Can you face towards the TV for me? So what I'm doing here is I'm just assessing your spine so it's nice and straight. I'm then assessing your hips. They look level. She does have a little bit of a valgus collapse happening at the knee, and then does have some pronation at the feet. So let me just document that real quick, that you do have some valgus collapse at the knee. So throughout this, I'm going to be documenting here and then, so don't think that I'm ignoring you.
Okay.
Next, I'm going to just poke around a little bit and look at some of your landmarks. So your PSIs are normal and level. Next, I'm going to feel iliac crest. Any pain with any of these?
No, that's
No.
fine.
Okay. Coming around. And then, so your pain's mainly here?
Yes,
Mainly down right in that area?
correct.
And then you said it radiates down a little bit?
A little bit, not all the time, but yes, there's
Yeah.
some times it does that, yes.
Okay. We're gonna assess ASIS. So all of those are level. So next what I'm gonna have you do is I want you to walk towards the TV and then back towards me. So what I'm assessing for is, does she have any valgus collapse at the knee or any overpronation? I do notice that she has some left hip drop on the so she has left hip drop, so she would have some right glute med involvement. So she has kind of Trendelenburg gait. Next, what I want you to do is you perform a squat for me. So can you have your feet shoulder width apart? And I want you to squat down. Good, and come back up. Any pain with that? Pain with some squatting?
A little bit, yeah.
Yeah, some pain. So painful squatting. She has a lot of quad dominant squats, so her knees are coming over her feet. So quad dominant, mainly quad dominant on the right. Next, what I want you to do is, I'm going to stand behind you. So make sure this is still recording. Yep. I want you to stand on your right leg for me. Good. So what I'm noticing here, besides that her balance is bad, is that she does have that left hip drop, so her glute med is weak on that right side. All right, you can put your foot back down. Can you do the same on the left side for me? Good. So this one's a little bit stronger. She doesn't have that hip drop, so it's Trendelenburg on the right. Next, can you perform some heel raises for me? So just come up on your toes. Any pain with any of that? No. Pretty easy. Good. All right. So next what I'm going to have you do is, can you bend down and touch your toes for me? Any pain with any of that? No.
Oops. No. Then falling
No
over.
pain.
Okay, no.
Alright, can you come down again? I'm just gonna apply a little bit of pressure. Any pain?
No.
Alright, good. Next what I want you to do is can you extend back for me? So extend your head. Any pain with that? No. Alright. Come back again. I'm just gonna apply some pressure. Any pain with that?
No.
Good. Next, can you come, so you're gonna bend over to your right side, following your right leg down. Any pain with that?
No.
Can you do that again for me? Just applying a little bit of pressure. Any pain?
No.
And then on the left side. Any pain?
No.
Good.
No.
Next one, what we're doing is we're putting our right hand behind our leg, and we're extending back and rotating. Any pain with that?
No.
And then can you do that on the left side?
No.
Nope. Okay. Lastly, I just want you to bend down and touch your toes and kind of bounce a little bit. See if that reproduces any symptoms at all. Nothing.
No.
And then can we come back and just extend back a little bit? Any pain with that?
No.
Next what I'm going to have you do is I'm going to have you in sitting, please. So bring all this over here. So first what we're going to do is just assess some of your range of motion at your trunk. So first, can you cross your arms for me? And what I want you to do is I want you to rotate towards this right shoulder for me. Good. Any pain with that? Okay. Stay there. I'm going to apply some pressure. Any pain?
No.
All right. Can you come towards this shoulder? Any pain?
No.
Good. Next I'm going to come behind. So your PSIS and sitting. Still are level, which is good. Normal thoracic rotation. Next what we're going to be doing is assessing some hip range of motion. So first what I want you to do, or what I'm going to do is move your, I just want you to relax, and move your leg into some external rotation. Good. And then some internal rotation. Okay. So we're applying some overpressure. So she has more internal rotation than she does external rotation. Assess the same on the right side. Does anything cause you pain coming, this more so causes you more pain coming into external rotation?
Yes.
Okay. You also do the same on this leg. Coming in. So next what I want you to do is I'm going to take some measurements. What I want you to do is to bring this leg in for me. Keep that leg on the ground coming in. Good. So I'm measuring with her, so on this patient I'm measuring 20 degrees of hip external rotation, and then can you come out? I'm measuring 40 degrees of internal rotation. 40. Next what I'm going to do is I'm going to assess some of the strength that's in your legs. So first what I want you to do is can you bring your right leg up into the air for me? Good, and hold. I'm going to press down. Don't let me push down. Okay, a little bit of pain with that. Yeah. Next, I'm going to have you kick your leg out for me. Good, and hold. Good, nice and strong. So she was a 4 out of 5 for hip flexion. She was a 5 out of 5 for knee extension. Next, what I want you to do is to bring your foot up into the air. Don't let me press down. Good, 5 out of 5 for dorsiflexion. Next, I want you to do press down like you're pressing into a gas pedal. Good, 5 out of 5 on the right side. So I would do the same thing on her left leg as well, which is normal. And then after that, what I'm gonna do is test your sensation. So what I'm gonna have you do is, can you close your eyes for me? So I'm gonna be touching you along your leg, and I want you to tell me if it feels the same or different. So the first part is L2, feel the same?
Yes.
L3,
Yep.
yep. L4,
Yes.
and then L5.
Same.
Same, so same all the way down, so her sensation is intact. Next, what we're gonna do is some reflex testing. So first one we're gonna do is her Achilles tendon. Oh, her patellar tendon. So first what we're gonna do is, so normal reflex on the right. Normal reflex on the left for patellar tendon. Next for Achilles. So normal Achilles reflex and patellar reflex. Next, we're gonna assess Babinski. So she's ticklish, but not symptomatic for any upper motor neuron lesions. Same with that. Clonus, bring it up. Negative. Negative. Next, what we're gonna do is we're gonna have you lay on your back for me. So first what I'm gonna do is I'm just gonna assess some of the range of motion that's going on at your hip. So first I'm gonna bring you through, pain with that, yeah. That. Assess on the other side. So she does have some limited hip flexion, I can see. Passively, I am able to get full, but I want you to hold that there. How far can you hold it? So I have the fulcrum at the greater trochanter going towards the lateral epicondyle and then bisecting. And I'm at 110, which is actually less than what even what the case said. So she does have some limited active flexion. You do that again with this leg. So greater trochanter, really painful, right? Yeah.
Yep.
Yeah. So we're limited there. We're at 100. So right was 100. Left was 110. Next, I'm going to do some internal and external rotation. So for external, I'm going to rotate your leg in. So a little limited there. Internal rotation is not as bad. Knees popping. So I would do the same on her left leg as well. Coming up. Assessing. So did passive for that. So those are all, they're decreased a little bit. Not bad. Next, I'm going to do some special tests. So the first one I want you to do is, can you raise your leg about 6 inches off the ground for me? Yep, your right leg, good. Any pain with that?
Yes. A little bit. No.
No, no pain. And then if I add this, any pain?
No.
Nope. Yeah.
Remember where my pain is.
Yeah, you have no pain with that. And then the next one, so we're still assessing to see if that right side is affected. Can you lift this leg up for me? Any pain
No.
here?
No.
Good. So negative for those. lastly, what I'm going to do is I'm going to bend your knee up. Just over here. Apply some pressure. Any pain?
No.
No, no pain with that. Good. And then I would assess the same on the other side as well. So one of the tests, so you were saying that you were having some lateral pain, but then also some piriformis. So what I can do is a fader test. So what I'm doing is I'm flexing the hip, I am adducting and internally rotating, and that should cause you some pain. So that's positive.
Yes.
On that side, we do it on time. Flex, internally rotate, and negative on that side. All right, now I want you to go into side lying for me. So actually, before that, I would assess dorsal pedal pulse, make sure that that is all intact. Yep, so she has good blood flow into her feet. I would assess the same on this side. So next, can you lay onto your left side? So first what I want you to do is, can you bring your whole leg up into the air for me and hold it there, don't let me press down. Pain with that?
Yes.
Yep, so she has the pain, she's about 4 out of 5 with some hip abduction. With this too now, what I want you to do is just relax, I'm going to hold on to you. So this is an Ober's test. What I'm going to do is I'm going to apply pressure at the iliac crest. What I'm going to do is I'm going to let your leg fall down. And what I'm noticing is that she does have some tight IT band, so she is not passing neutral. So she has a positive Ober's test. Lastly, can you go back onto your on your back for me? So what I also want to rule out is some OA. So I'm going to do a Scour's test. So I'm going to flex, internally rotate, and just kind of grind through and see if she has any pain with that. No, no pain.
Okay, no pain.
No pain. So she's negative for the Scour. Next, I'll have you flip over onto your tummy for me. So the first one I'm going to do is assess for femoral nerve, and that would be negative there. Assess on the other side. Any pain? No. So negative there. The other thing I can do is assess some hip extensor strength. So can you lift? Actually, it's your right leg, so we're opposite now. Can you lift this right leg up into the air? Don't let me press down. So she has about a 4 out of 5 strength on her hip extensors as well. Lastly, what I'm going to do, two things. We're going to assess her spine. So what I'm doing is I'm doing some spring testing through her spine. So I'm starting at T10. It's almost towards the edge of her ribs. She's a little ticklish when we do this. So I'm going to get a good skin lock, assess. As I'm going down, so T10, T11, T12, L1, L2, L3, L4, L5, and then once I get to S1, I'm going to rotate my hand and do a spring test there. I would then do PIVMs as well, so that's lateral to the spine. Do the same thing, assessing for hypo mobility. It appears to be all normal there. So spring testing was normal. Oh, so I also want to do a mobility assessment. So for this one, I'm going to assess a posterior anterior glide to try to see if extension is limited. So I'm going to extend the patient's hip back. I'm going to find her femoral head. I'm going to apply pressure down. And then I notice that she has some hypomobility on her right side. I would then do the same on the left, and her left hip is not affected. So it's mainly on the right side with that pain. And then as I palpate around, you have any pain here? Yeah. So into her piriformis, she has some pain. Underneath her gluteal fold, I could do ischial tuberosity, palpating around, so that's not as painful. It's mainly coming from this lateral side and into her piriformis. Make sure I got all my measurements. I think we are good to go. Thanks for watching.